What are the best modern treatments for bladder stones? Imagine having tiny stones forming inside your bladder that cause discomfort, frequent urination, or even pain. Modern medicine offers several effective ways to treat these bladder stones, focusing on minimally invasive procedures that are safe and efficient. The most common approach is endoscopic surgery, also called cystolitholapaxy. During this procedure, a thin tube called a cystoscope is inserted through the urethra into the bladder, allowing the doctor to see the stones clearly. Using specialized tools, the stones are broken into smaller pieces with laser, ultrasound, or pneumatic devices. Laser lithotripsy is now the standard because it has a high success rate, low risk of complications, and can be combined with other surgeries like prostate procedures. Ultrasound and pneumatic devices are also effective for crushing stones quickly. Mechanical crushing tools are used as well, but electrohydraulic devices are less favored because they carry a higher risk of bladder injury from stone movement during treatment. For larger stones or cases where the stones are difficult to remove through the urethra, a procedure called percutaneous suprapubic cystolitholapaxy may be used. This involves making a small incision in the lower abdomen to access the bladder directly. It is especially useful for children or adults with big stones and helps avoid injury to the urethra. This method is performed under general anesthesia and allows for the direct removal of stones. Another option is extracorporeal shock wave lithotripsy, which is non-invasive. It uses focused shock waves from outside the body to break the stones into smaller fragments that can pass naturally through the urine. This treatment is less invasive and often used for smaller stones or in children. Multiple sessions may be needed to completely break down the stones, and precise positioning is important for success. Medical management also plays a role in supporting treatment and preventing future stones. Doctors may prescribe oral alkalinizing agents like potassium citrate to help dissolve certain types of stones by changing the urine's pH. Addressing underlying causes, such as bladder outlet obstruction or infections, is crucial because these conditions can lead to stone formation. Ensuring proper bladder emptying and treating infections can reduce the risk of stones coming back. Supportive measures like drinking plenty of fluids can help flush out small stones, but they are usually not enough if the bladder cannot fully empty or if stones are large. It's important to remember that each case is unique. Treatment choices depend on the size, number, and type of stones, as well as the patient's overall health and anatomy. Modern techniques aim to minimize risks like infection or injury, making recovery smoother. In the context of bladder health and bladder cancer prevention, treating bladder stones promptly is vital. Chronic irritation from stones can lead to inflammation and increase the risk of tissue damage. Addressing any underlying issues not only helps remove current stones but also reduces the chance of new stones forming. Always consult a healthcare professional for personalized advice, as they can recommend the best approach based on your specific situation. Overall, combining minimally invasive procedures with medical management and addressing root causes offers the safest and most effective way to treat bladder stones today.